I'm Julie Bartke with Session Update. Governor Mark Dayton was joined by Human Services Commissioner Lucinda Jessen and several lawmakers in the first bill signing of the session, the expansion of medical assistance to more than 35,000 Minnesotans. This expansion is one of the components of the Affordable Care Act. We'd like to show you a portion of that bill signing from earlier today.
And I'm really pleased to note that this has the support of 6 Republican legislators, and that's a great step toward bipartisanship, and also the support of the Minnesota Chamber of Commerce, the Minnesota Hospital Association, Legal Aid, and the Minnesota Council on Health Plans. So once again, there's broad mainstream recognition that this is a good deal for 36,000 Minnesotans. It's a good deal for Minnesota, and that overall, it's going to reduce the cost of the health care coverage for the rest of us who are on private insurance, because when people in this situation become ill, they usually don't take, since they don't have medical coverage, they wait until they're really sick, and then they go to hospital emergency rooms, and those costs are higher, and those costs are passed on to those patients for whom the hospitals have coverage. So it's a big step forward for Minnesota.
This really is a great opportunity. It is up to the states each time the federal government offers us a partnership with them to decide whether or not it's in the best interest of our state to make that agreement. This is a voluntary agreement on the part of the state to participate with the federal government in getting health care coverage for, it's really a part of an overall goal, which is health care coverage that's accessible, that's affordable throughout the entire state for all people. And this makes it possible for individuals whose income is under $15,000 to be able to have access to health care, to preventive services. It's positive, as the governor said, for businesses who are in the health care industry that have uncompensated care that will now be covered because these people have health care coverage. So it provides an opportunity for us with federal dollars that we spend of federal taxes, we send those to the federal government. Now we're beginning to draw those back into the state to help us cover the needed services for people up to 138% of poverty. The money that we're saving from this, besides the expansion, the savings we'll have in the Minnesota Care Program, will bring money into the state's general fund. And then those dollars at the state level can be used to afford this opportunity to more people to have access to affordable health care.
One of the other major issues concerning the Affordable Care Act is the establishment of a Minnesota insurance marketplace, and we'll of course continue to track that legislation as it continues to move through the process.